My name is Ken Lim. I have been practicing dentistry since 2017 from Lubbock, Texas. Did dental school out in California, Western University of Health Sciences. I've been involved with Implant Pathway since 2020. You get into dentistry, and the biggest thing that sparked my passion about dental implants, honestly, was you always do your best at every stage of your education. In dental school, we're trying our hardest, but we're kind of trying our hardest just to get by and survive and graduate. And you graduate, and then you get out into the real world, and then you just start realizing and seeing cases and treating real people all the time and thinking, oh my gosh, there's so many more complicated problems that I don't know how to fix. And for me, that was that just bothered me because I wanted to be able to fix everything. And so really getting into implants was kind of like it was a progressive journey. Ultimately, I wanted to learn everything. So I was trying to learn how to do full mouth reconstructions, crown preps, entire mouth, restoring really, really complex cases. And I was also, learning how to do endo and root canals better. And the gradual progression got to implants. And really, I wanted to take implants the whole time. But back then in dental school, it was just not really something that was really extensively gone over with students. So I came out, kind of barely knowing the bare minimum about dental implants. And then once I progressed to that point of my career where I knew that this is the last frontier, I've learned everything else in dentistry. Um, Implants is the last thing that I need to do. But then it just became, what's the best way to go about doing that? And that's kind of one of those things where it's like, hey, you can read about it all you want, but I have to actually do this. And it becomes a little bit more nerve-wracking whenever you're thinking like, oh, now this procedure I'm going to do is actually a surgery, which most general dentists seem, I was there at one point as well, but it becomes a little bit more daunting. But if you're able to get some live surgical experience, then that is kind of what sparks the passion. And then once you get that live surgical experience in a controlled environment, with the best mentors like by your side, holding your hand if they have to, it's like then it becomes fun, and then you realize like, this is what I want to do. So that is ultimately, I think, how my passion for implants came to be. Much credit to CEs, but especially Implant Pathway. Yeah, so if I could go back, give my younger self a piece of advice before starting implant training, I think that's a really great question. Um, Obviously, everybody that I meet through Implant Pathway that I, have the honor and opportunity to get to work with and mentor, um, everybody always asks for advice. What do I take next? How do I get to do what you're doing? Which, now I work in a clinic where we focus mainly on full arch implants, and that's the sexy, hot thing that everybody wants to do. Um, and I'm not saying that, you can't do that right away, but, the big advice that I give is, it is vastly beneficial to learn and still be improving and still still learn about all the other aspects of dentistry, all things restorative and, whether basic or complex, because, um, that is understanding like true, really good treatment planning, basic, more complex restorative and prosthodontic principles. These are the things that are going to set you up for success when you get to implant surgery. Yeah. What surprised me the most about the live patient experience in the courses? Initially, kind of like the evolution through Implant Pathway, when I took the course, I was just it just seems like a lot, for somebody coming in and maybe you barely do surgery in your office or you're not exposed to a lot of surgery. You step in our, 30, 40 operatory surgery clinic and there's surgery going on in every room. It can just seem like, like crazy, hectic, overwhelming. But, ultimately, like the biggest surprise once you get past that shell shock of like, wow, this is just like a fast-paced environment with a lot going on. Um, you start to treat these cases that in your practice, sometimes you'll get a really easy case at Implant Pathway, but you'll definitely end up with some more difficult cases too. And these are cases where sometimes you'll think, oh, there's no way that we could possibly do an implant here. And, different mentors all have different approaches. Cumulatively, we all have so much experience, and it's like you're going to learn a way or a technique to figure out how to work and navigate through that situation. So yeah, the biggest thing I think that would surprise me is just how much this clinic and the mentors are all capable of. It's like there's a case that you just don't think you can do, but between somebody in our mentor faculty and the equipment, the tools, and all the things that we have in our state-of-the-art clinic, it's like we will and can find a way to treat these patients. Yeah, so a lot of implant CEs out there. Ultimately, I took a couple of Weekend Warrior implant CEs just on doing tabletop sawdust models. Um, learning the bare basics, also learning, how to do a surgical guide or use a surgical guide on a sawdust model. But ultimately, when I went back on Monday and then felt like I was finally ready to do the procedure, I like sad to say that, I got through the whole procedure, but the whole time it went well, but the whole time I did not actually feel like I was in control. And by that I mean I got to the end and I was just like, well, I actually don't know why I did each step that I did. Like I just knew I'm supposed to do this, so I did it and I followed the rules, but why do those rules exist, And after doing, maybe 5 implants on my own and just always feeling that way, that's whenever I went from wanting to take just like hey, an okay, good, average, like Weekend Warrior CE course that was free, to, what, like I'm going to invest in myself and spend the money to learn how to do this the right way. So I can feel like I actually know what I'm doing. Because once you're doing surgery, it's like these are irreversible processes that seem a little bit more scary than just doing like a normal filling. So I do think what, separates the great course from the good courses is a thorough teaching of learning the proper approach of a procedure, and then hammering it home with a live surgical training experience because that is what everybody's scared of is doing the live surgery on their own. And then, you know, aside from, live surgery is the next level, but then it's like, what is the quality of that live surgery? Because there are plenty of courses out there, and we have plenty of students that come to us from other courses that say, I placed 30 or 40 implants at this course, but I had no idea what I was doing. There's not really somebody watching me the whole time, or nobody walked me through it like this. And I think that's what separates a great course, which, like, I believe Implant Pathway is a great course from other just good courses in implant dentistry. You know, you're going to be in a one-on-one mentoring environment. I will, we'll hold the drill if we have to with you. We stop you in the middle of the procedure to talk about something. Somebody's watching you all the time. And so I can't say that that's probably the same for a lot of other courses, which are the good courses, right? But then there are other great ones that operate with the same type of structure we do, and I think that we were kind of, I feel like we set the bar for that. So why only in, if you had to invest in one type of CE, why would you choose implants this year over anything else? Well, ultimately, you know, it it's because it would be the right time for you to take that CE, right? At Implant Pathway, we offer a vast range, beginner implant CE, even like more beginner than that, like just basic extraction CE, extract and graft. Then we have the basic implant CE. Then we have like the all neck CE. And then we have remote anchorage for the very advanced people. you know. And, you know, if you're just at that point in your career where, hey, you feel like this is you feel comfortable with other things, or you've already figured out what you do and don't like to do in dentistry, and you think that implants is something that you would like to do, then it's the time to do it. And, you know, once you do it, you know, it's very rare that I ever hear of anybody coming to take the course, then that they leave and they say they don't want to do this. But even if they did come, they're not upset about it because you at least learned so much about, hey, how does this implant process work? And now I actually know, even if I'm not going to do the procedure, like how could I set my patient up to go through this process, you know, as seamlessly as possible, right? Like, and then knowing now what it takes to do good implant surgery, it's like you can now vet out who you're going to refer these patients to, right? And what type of care you should expect from them. Or now you see those cases come back from the doc you referred it to, and you can actually, you know, figure out, you know, was this good? Was this bad? Or what was the reason why this ended up this way? And then maybe you can have the wherewithal to address that situation, you know, whereas versus before, you may not have any idea how to handle that. So, you know, I don't think there's ever a bad time to take implant CE. However, I do think if you're even thinking about it, it's probably the right time to take the implant CE. I totally get it and totally understand. CE like this is a huge investment. But honestly, with the summer offer that they're doing right now, it becomes way more affordable and way more doable probably for your financial situation. So you can save $1,500 off if you pay in full. So that's $13,500 in total. Or there's also a 6 month plan at $2,500 a month, no interest, no extra fees. So, you know, if cost has been the blocker, which I get it, I was in that situation at one point too, this is a really good time to jump in. So, you know, now's a better time than ever. Grab your spot this summer because it's just a limited summer pricing deal before the enrollment fills up, which it fills up all the time pretty fast.